Fine. Okay. When you see the coding part, it is pretty simple. It is 17311, 311, 312, 13, 14, 15 over 311, 312, 13, 14, 15. 13 and 14 is for tall region, 11 and 12 is for non-tall region, 315 is for block over. If you by heart this is more than enough for you. Let's see one example, and you should understand routine staining is bundled. And also imagine if the physician is taking a biopsy that is not separately reported, because those biopsies are all bundled into the Mohs surgery itself, because he's excising and studying it, right? But if the provider is reporting a biopsy, in that case it should be for a different site, or they wouldn't have performed the confirmatory biopsy. If that is the case, you can report biopsy. Otherwise, you are not supposed to report Mohs surgery and biopsy and routine stains on the same day of Mohs surgery, unless these are for a definitive purpose, and also if it is of a different anatomic site. The lesion is entirely different. In those cases alone you can report. Otherwise, no, you can't report a biopsy and a Mohs surgery on the same day. Okay. Now, if I am going to give you one example where the doctor is going to excise the cancer. So the patient has a cancer of the cheek, so for which he is going to excise it in 2 stages, in the sense 2 layers and 6 blocks for the left cheek. And for the right cheek, the surgeon is again going to remove the lesion in 3 stages and 4 blocks. Let's see how we can do the coding for this. See, it is left cheek, right? So we know that it is a non-tall region. So for a non-tall, we know it is 11 and 12. So it is in 2 stages. So 11 for the first stage and 12 for the second stage. So 17311 and 17312, right? And the number of blocks is 6. So you should know 315 is reported after the 5 blocks. After 5 blocks only you can report 315. Now there are like 6 blocks. So you can report after 5 there is only 1 extra. So 315 times 1. So for the lesion on the left cheek, now the coding would be 17311, 17312, 17315 times 1 over. Now coming to the right cheek, again it is in 3 stages. So 311, 312 times 2. It is in 3 stages, and 4 blocks are bundled into 315. So you cannot report it. With every stage excision, up to 5 blocks are bundled. So you cannot report blocks excessively unless if it crosses 5 blocks. So the final coding would be, there are 2 311. So you will have to differentiate with either a modified 76 or a 59. So the final code would be like, for the left and right cheek, you will have to differentiate. So 17311 for the left, 17311 for the 76 for the next, and you can add both the 312s. So 312 times 3 and 315. So this is all about.